Hi, my name is Heather Baltzer, and I'm a hand and peripheral nerve surgeon at University Health Network in Toronto, Canada.
Hi, my name is Chloe Wong. I'm a plastic surgery resident at the University of Toronto. I'm currently pursuing my PhD in clinical epidemiology under the supervision of Dr. Baltzer.
We're here today to talk about our paper. A dedicated trauma operating room for hand surgery reduces after-hours cases and costs without affecting wait times, a retrospective single-center cohort study. This was published in the Journal of Bone and Joint Surgery.
And we were interested in this research because hand trauma care is often pushed into after-hours operating time, which can impact both patient outcomes as well as provider well-being.
One of the issues that we faced at our institution for many years was that when we were seeing these hand trauma patients in our clinics, which we have very high volumes of, we would have to put them either in unspecified triage time, admit them to the hospital, or squeeze them into our elective times. And so it was quite unpredictable. It put a lot of weight on the surgeons and created a lot of burnout. It also wasn't an ideal way to deliver patient care. And so we looked at the amount of time that we were spending doing this, and we saw that it added up to at least one day a week. And so this became how we advocated to leadership to have a dedicated trauma OR.
And one of the unanticipated challenges that we had was separating the effect of the dedicated trauma operating room from other changes that happen over time, like shifts in case mix or workflow.
So in order to adjust for this, we had a very rigorous analysis that looked at patient and operative level factors and focused on measurable outcomes like timing of surgery, complications, and operating room cost to isolate the impact of having these dedicated trauma ORs as much as possible.
And what we found was that implementing a dedicated trauma operating room reduced the proportion of after-hours cases from 18% to 8%. And after adjusting for patient-level characteristics and operative characteristics as well, this corresponded to a 53% reduction in the odds of after-hours surgery. So this was an adjusted odds ratio of 0.47.
What was really surprising about this is that it didn't lead to longer wait times for the patients to have surgery, but it did significantly reduce the number of complications that we were seeing in our patients, as well as the hospital costs, showing that improving access can enhance both efficiency and outcomes without any significant trade-offs.
And so overall, this does suggest that a system-level change like a dedicated trauma operating room can be both clinically and economically beneficial in hand surgery.
So based on the findings of our study, we would recommend that hand surgeons approach their institutions to try to advocate for having dedicated hand trauma OR time.
And while we assess this model in a universal healthcare system, we believe it does have the potential to improve efficiency, reduce after-hours burden, and enhance patient outcomes without compromising access.
I think the most important remaining question is we looked at this in a single institution, and we really need to see if this is generalizable across a healthcare system.
We're currently working on linking our data to population-level administrative data to evaluate the full episode of care costs and better understand the wider impact of this model.
Thank you very much for your interest in our work.